All right, so welcome back to our extended coverage here on the Grand Solar Minimum channel. We want to thank everybody for joining us. Just a quick update, though, and I don't want to mix it with too much with the Grand Solar Minimum news stuff. So I figured if we're going to talk about this, we could definitely just take a what do you want to call it? A live chat without, people who don't want to listen to it, they could choose to leave after we do the broadcast and then do an extended broadcast like we're doing right now and talk about what's happening right now. So here's a website that I found, worldometers.info. And as you all know, we're having some issues with the John Hopkins website. In fact, Maury, I'm going to check that right now to see if that's come back. And it's kind of just, it's concerning when you see an informational site like the Johns Hopkins website go down, because now you can't keep track of it. Now you can't watch, you can't keep an eye on what's going on. And I'll tell you something right now. I got to give kudos to you. I'm not going to lie. In the beginning, I thought maybe some of your actions were a little much. You decided that we should pull the kids out, let the kids sit this week out, and look at all the school closures that have followed this week. I mean, the state of Ohio.
You thought I went a little crazy.
Well, it was a little much. And, what's weird is that a lot of people are, everybody says don't listen to the media. Don't listen to the news. The news and the media are the ones telling you it's okay. It's just the flu. 90% of you are going to get mild conditions. Don't worry about it. But have the headlines changed and just in the last 48 hours?
Watching, I don't know if people can hear me okay, but watching it unfold from, when did we start reporting on it? It was in January, wasn't it?
Mid-January.
So watching it unfold, and when it initially started to unfold, the mainstream media, you could go back and look, I'm sure they were just saying, it's no big deal. It's just the flu, blah, blah, blah. And when I started researching that before even MSN was reporting this hysteria they're reporting now, I just had this awful gut feeling this was not good. And the more I dug and researched, I'm judging all my actions on doctors' responses and nurses' responses. And it's amazing to me the amount of kickback I get online saying that I'm being sort of in hysterics and fueling things when I truly don't believe that's the case. We are in a crisis mode where multiple countries' healthcare systems are going to collapse. And I can't stand seeing the loss. It's a brutal reality. And I'm telling people right now, the unbelievable needs to be believable now. You need to believe this. And I think a lot of people have cognitive dissonance that this is happening because it seems so surreal and just bizarre, because and this is what we've talked about for years on this channel, how easy it is to take for granted a normal way of life, how easy it is to go into a store and just get what you want, how easy it is to go in and just get the health care you need and not have to walk into a healthcare center worried that you're going to get this nasty virus that might kill all your elders in the family. We live in some very interesting times. And I know, Jake, you thought I was a little extreme saying no kids going to school, all that, but preventative measures need to be extreme to slow down this virus so it doesn't tax our healthcare system. And if our government and local governments aren't going to do anything they're essentially choosing monetary gain over human life at this point. So it's each of us as individuals to do our part in trying to make our system not collapse. Do I think it's too late? I think we're borderline right now. Unless we take some drastic measures in the next 2 days, I don't know if we're going to be seeing a lot of the things that these other countries are seeing, unfortunately. And I don't think a lot of people in the great majority are prepared for it. And I don't have anything other than that to say, Jake, really. It's sad to me that I've been sort of attacked on social media, on Facebook, pretty bad, because I've been very vocal on Facebook about it. And people just say, I'm going to look back on this and, be ashamed of myself for acting out like so conscientious, so vocal.
Yeah. Well, and I'll go back to our graph here, and thank you, Mari. But so this website is very reliable, I think, right now as far as chasing the numbers, keeping track of things. And like I said, I thought Mari was a little much in the beginning of the week, but look at what's happened. We've got NBA suspending their season. Major League Baseball is not going to do their open. They've canceled spring training games. There was a college basketball game in halftime that was called at the end of halftime. They exited everyone out of the stadium. They said, we're canceling everything. So colleges across the country are closing. The state of Ohio shut it down. Pathetically, the community that I live in, their school systems thinks closing the buildings down on the weekends to visitors is going to be enough to hold the spread down. Look, if the state of Ohio is willing to close all of their schools right now, or starting on Tuesday for 3 weeks, they are taking the correct measures to prevent the spread, allowing people to, and look, right now, if you think about this, New York, there's a ban now on gatherings for more than 500 people or more. Retail businesses and restaurants and bars, they have to slash that in half, so it's 250. I don't know who is going to be standing in Walmarts and Targets and busy shopping centers doing a head count, or the mall, or whatever it may be in the state of New York. It already feels like the government's prepared to pay leave for people for missing. And I think a lot of the reason why they're not closing schools, and this is New York's defense, 2 reasons. One is that children that don't eat, they rely on their food source from school, which is true. There are kids out there that suffer, and unfortunately the school meals are the best meals they get of the day. So that's a big concern. But then the second one is that New York, in my opinion, and forgive me, all the New Yorkers out there, but there's too much pride out here. There's too much ego. We're too big to fail type mentality. Therefore, if we shut down schools, then parents that work in these office jobs, your car dealerships, your restaurants, your bars, your movie theaters, your shopping malls, whatever, those people have to stay home. And then those businesses start to suffer because now they're losing money because they don't have any workers. But let's face it, are there going to be any people out and about during these school closures anyway? I think the fact that school closures are going to happen in your own backyard is going to be very sobering. And you might want to exercise what work leave things that you have in place for your employer. The only silver lining to what's going on with me right now, I'm not having any corona issues, but I'm having other issues that could be related to my diabetes internally. So that is a different subject. So I have to go back to work on Monday. There's not been an announcement from my company, and we deal with
let's just hope we don't get some fevers,
of
Jake.
people a day. I mean, what I do for a living in my day job, I see hundreds of people a day. So I thought this website was going to be useful. I think everybody should use this. This is the best put together. The Johns Hopkins website might be hacked. That's the rumor. So worldometer.info, and these numbers are interesting. I've updated this several times. Let's check out country by country. Italy gained 2,651 cases in 24 hours. Iran picked up another 1,000. South Korea is slowing down. That's a good sign. 224 new cases were reported today. That's a very good sign, but South Korea is not that big either. So still trickling in. Their death rate's not as bad as other countries. Still, 67 people have lost their lives in South Korea. In other countries, it's worse. Spain's got 3,100 cases total. That was an explosion today of 869 new cases. And they have 86 deaths, 31 new deaths today. Italy, so far today, has the most increased deaths, 189 in 24 hours. Iran gained 75 in 24 hours as well. France today gained 595 cases. Germany picked up almost 800 cases. And the United States, 424 cases. So each day since Monday, we've seen an increased amount of what can you say cases here in the United States. Right now, the death toll in the United States is at 41. That's actually went up a little bit today. We started the day with that's a +3, so 41 deaths now recorded in the United States. A total of 30 have recovered in the United States. 10 cases right now are critical in the United States. There are actively 1,600 cases here in the U.S. So this chart gives us complete details, and I really appreciate information like this. I feel like, and also down at the bottom, look at this, latest updates. New Mexico, this is new. New Mexico is now closing schools K through 12 for 3 weeks. Washington State governor orders schools to close until April 24th. King, Pierce counties. Maryland will close all schools for 2 weeks starting on Monday. Ohio governor closing schools at least through April 3rd. A lot of people are saying at least. California, many schools in the Bay Area close as well. Kentucky, all schools to close for at least 2 weeks. Massachusetts, number of schools are closing, probably more. This could be easily a 6-month crisis, said New York Mayor Bill de Blasio as he declared state of emergency on the city on Thursday, adding that New Yorkers should expect major changes from day to day because there's a pattern of extraordinary new information on what feels like an hourly basis, with at least 328 total cases in New York. It seems like more than 100 were added today. The number of cases in the city projected to rise to 1,000 by next week, just in New York. Jamaica closing all schools. The UK infection expected to build to a peak in May or June. So does that mean the United States peak we'll see sometime in May or June as well? Because they started picking up, well, they were a little bit later than us. So our peak, from what I've heard experts say, we're talking about April or May. But the list goes on and on and on of closures all over the world in the United States. And I'm really appreciative of this website right now. I tell you, it's look at this. It even gives us updates and cases in each state right now. So this website is the most in-depth that I've seen on the internet, guys, and there's tons of information on this. So bookmark it, but listen, let's not get obsessive about it. Let's try to continue on with our daily life. Let's continue to, live our lives with common sense. Like they've always said, wash your hands, that kind of stuff, cover your cough or sneeze. Mari, I saw today on Fox News where the new thing is now wash your coat every 1 to 2 days. You're supposed to come home from wherever it is you're outside and take off your clothes and put them in the washing machine immediately.
Well, have you noticed, Jake, I finally got my mom out of the house on Saturday. She finally sort of broke and took me serious about getting some prep in her house so she has enough to get her by for a little bit. And the cashier, we had so much stuff we couldn't do self-checkout. So this cashier, she's hacking and coughing all over me, my mom, and my daughter. And she's like popping cough drops in her mouth. And I'm a germaphobe already. And I sprayed everything down with Lysol that she touched and at that point, when someone coughs in your face, it's like, that's it. So I hope she don't have anything. All I know is Monday, I've had a headache and it's gotten way worse. Today is what, Thursday? And it's like this nonstop, it's almost like a migraine, but not as extreme as a migraine. I don't like being in rooms with lights on, and no OTCs touch the headache. It's like it just won't go away. So today I spent most of the day in bed, didn't I, Jake?
We both did. And, I hope it's just stress and anxiety that's caught. We both have the headache, the fatigue I have. I think it's going on with my underlying issue. I'm diabetic, so I'm having some issues right now. It could be related to pancreas type situation. I have more tests and blood tests to take tomorrow, but the good news is that, well, I don't know if this is good news. The thing that's frustrating to me is that I did tell the doctor of some symptoms that Mari and I have both discovered with the Chinese, and that was headache and nausea and diarrhea. Well, I'm a candidate for all three of those. Now, no fever, no cough, but I am diabetic. My blood sugars were a little high at the time of the visit. And this is just to let you guys know that the testing isn't ready yet, because if you're sitting here and you guys have been following this, you guys know that people that have the diabetes, heart disease, lung disease, or if you're 6 years older, you would think that if you're experiencing any of those symptoms, stomach ache, diarrhea, fatigue, that you would be asked to take a test to find out if you do have this. And they're not offering the test. I can tell you that right now. I've been to a doctor now 2 days, 2 days in a row. I'm going to go for a third day. And I'll give you an update if I was asked to take a test or not. I'm willing to take a test. I'd like to know, because what concerns me and Mari is that there were early cases in China where people were experiencing abdominal pain, diarrhea, fatigue. Those were part of the system or the symptoms that showed up before the virus kicked in. And again, they're just asking you, have you been coughing? Do you have a fever? And are you shortness of breath? Those are the main three questions. Have you traveled outside the country? If your answer is no to all that, they're right now, from the feeling I'm getting, and being in front of a doctor twice, 2 days in a row, experiencing symptoms that could be connected to corona as far as the fatigue in the stomach. They did not offer me a test. So that's the scary part, is that that's the CDC and other people who are crying about tests not being ready and available. Those aren't fake news. That's real. And I can tell you that right now, just from my experience 2 days in a row.
Well, I mean, I'm a member of a bunch of different coronavirus groups, one in particular for our state, and there is no end of documents where people are very concerned that they got back from Italy a few weeks ago and they've been begging for the tests and they're not getting tested. They're showing symptoms. And, it's to the point where I know one lady had an instance, and I believe her comments are in Andrew Cuomo's latest video from today. She said that, she has 4 kids. She's been begging for the test. The school district doesn't mind the kids coming in, even though they've been exposed and are showing symptoms, fresh off the plane from Italy only by 2 weeks. So you gotta understand, I believe these numbers that you're seeing are at least 2 to 3 weeks behind what reality is. Honestly.
Yep, I agree. And, here in the States, as fast as it's spread without limited testing right now, and let's go ahead and just hit the refresh button just to show you that this is real time. 1725 is now the total cases in the United States. That's soared, folks. And I do mean soar, as in rising fast. I hit the refresh button. She's thinking. But, did we do enough quick enough? Yes, we did shut down the flights from China back in early January, but no one took in consideration that other people from around the world would fly through China, Europe. So nobody really took all that into consideration. Oh, I thought the site crashed. I wouldn't be surprised, actually, at this point. but no one took in consideration that it was going to spread like the way it spread through the Middle East. I mean, it went west to east, or east to west, whatever you want to say there. So lots to be worried about. For those folks out there who just said it was just the flu, you know, I hope you're right, but I've never seen in my lifetime the stock market dropped another 2,300 points today. A lot of people, even Republicans, I saw a lot of criticism on President Trump's speech last night. They didn't feel that it was genuine. They didn't feel it was honest. They didn't feel it was authentic. They felt like that it was too much of a rehearsed script. They're not used to that from President Trump. He usually speaks off what he thinks. But the effort from the Oval Office was not pleasing enough to folks out there in TV land. And I get it. He made 3 major errors last night talking about testing, how it's going to be available, how the insurance companies are going to make all the coronavirus stuff free. That's fine. Now we're finding out that's not true. And then on the European ban, where cargo was said to be banned, but now they had to walk that back. So many things about the Oval Office presentation. Guys, it's like this. When you speak from the Oval Office, it's usually because there's something major happening. President Trump announced at 5 o'clock that he would 6 o'clock that he would be speaking once again at 9 p.m. Whoever wrote the speech had time to put this together based on the actions of the day. Trump had at least 2 hours to review this speech. A speech that took him 11 minutes to read live to an audience. 11 minutes is what it took him to read. The errors, the mistakes in the reading of it, and the awkward breathing that was happening during the speech shows me that it's possible that his anxieties, because his lack of practice with that particular speech, and that concerns you as an American citizen because if there's lack of practice on a moment that could define your legacy, you're going to be remembered for these moments. And from the Oval Office, and I be honest with you guys, it was in my opinion, a very sloppy moment, very nerve-wracking, not reassuring at all, and almost frustrating when you heard the lies about the testing. And I can tell you right now, I can't speak for everybody, but I can speak for myself that the testing is not here. I'm almost certain that they would offer me a test if we had the abundance and if we had the ability to, to be able to produce these tests. Edward goes, how exactly do you practice a speech like that, though? Edward, you have to review it. It took him 11 minutes to read it to live TV. That speech just didn't pop up on the teleprompter at 9 o'clock. He had access to that speech at least an hour and a half before it happened. And if not, fire your speechwriter. Shit. I mean, should have had it ready for him. This is a big moment. So in my opinion, a moment like this wasn't just some BS situation sitting from just some BS. He's just, talking about the virus and being wishy-washy. He had less wishy-washiness about him. Hey, listen, I'm just saying, I feel like there's some things that Trump could be doing differently. His policies are right, all right? His policies on the payroll tax, the bills that he wants to pass, those are right. I don't feel like it was ensuring, though. I feel like that he's still trying to not face the reality of what's happening right now.
Well, he's not being a fearless leader, and he's choosing monetary over human life right now. And that's my biggest concern. We simply have not done enough just to cut it off or slow it down. It's the failure to the nation by lack of testing. It's very upsetting. I know that they've denied different tests from other countries for various reasons. They're just not good enough, even though the other countries seem to be testing people fine. There's a lot of answers that we just don't have. And unfortunately, things will make more sense in hindsight, and we're just going to have to wait and see. So my best recommendation is prep the best you can and try to reduce your exposure the best you can, which may seem a little crazy since I'm dragging Jake to the doctor.
Well,
but
and listen, I'm not trying to drag Trump through the mud here. I'm just saying that this is probably hard for him to wrap his head around because, you know, he's taken us to parts that we've never been to with the stock market, the jobs, everything. This country was rocking before this coronavirus. So I get it. For him, this is heartbreaking on so many fronts that the people that he's sworn in to protect, to protect the American public. I know he feels like he's failing in that department because more people are catching it. I know he cares about this country.
Well, I think it's also, I think our states and local governments are relying too much on what he does instead of just having some balls and doing what's right for their own local community.
Would it be historic to shut down the country like the way some of these other countries? Yes. Would it be crippling to the economy? Yes. But that's why they're in Congress and Senate right now voting on a bill to help keep this. Look, if these major organizations out there, like the sporting leagues right now, the Major League Baseball, NFL, basketball, NCAA, they're canceling events that make them billions in revenue on a yearly basis. So we have to take a hint from, you got to read between the lines on this. And I think what's really going to happen is that Trump is going to rely on the governors to make their own decisions on when they want to close the schools. And I'm okay with that for now, just as long as...
I'm not being a New Yorker.
I
hate this.
Well, we live in the wrong state. We have the wrong leadership, for sure.
And you got to realize New York State is one of these big states that they want to make Trump look bad. They hate Trump here for not necessarily upstate New York, but a lot towards the city. It's just like sheep mentality down there. So
there's an article on AccuWeather you guys can check out. Experts skeptical that warm weather will slow down COVID-19 outbreak. I got to agree with this article too, because look at some of these countries that have warmer weather that are also showing cases as we speak. Places that are in a summer-like condition, warmer temperatures above 84 degrees. I know, Mario, you told me that was the magic number. So I'm not so sure either about if that's going to happen or not. As far as if the warm weather speeds it up, who knows? Yeah, that could be scary. Definitely scary if warm weather speeds it up. If you mean by infection rate or just the whole process, again, we are facing something that we've never seen before. And we talked about grand solar minimum and the effects that we would have from the grand solar minimum. And why is this being broadcasted on the grand solar minimum? Well, we've talked to people like Sasha Dobler. We've talked to people like Matthew Stein. Heck, we've even talked to Ralph Witche about this.
Even Lee
Wheelbarger,
last night on his channel, and he's telling people, buckle up. It's gonna. And I trust Lee a lot, and Lee hasn't been wrong very much at all since I've known him over the 4 years we've worked with him. And
he's been quiet.
He's been quiet lately, and it actually his quietness on this subject got me worried.
Yep.
And it was a relief to hear him last night just say, listen, this is not a test. This is get ready for some hard times. We're going to see some not nice things that we're not used to seeing, and just be ready for it. And that's all we can do, unfortunately.
Well, and like I said, we've talked about the dangers of the grand solar minimum. Like I said, we talked to Ralph, we've talked to Sasha Dobler, Matthew Stein, other folks, and there is a pretty decent sized correlation between cosmic radiation and viruses and disease outbreaks. We're having some issues with the internet. I hope we're still alive. I'm trying to get information from the website about.
I see that it says they can't be reached.
Yeah, I was trying to get on this website, useful info, symptoms, incubation period, mortality rate. Guys, if it works, awesome. If not, that's a bummer. But this website seems to be the best as far as information on coronavirus, tracking it and locating how many cases are in each country. Right now, the United States of America. Okay, so here we go. These are the main 3 symptoms that they are telling people. Fever, cough, and shortness of breath. But then if you click on symptoms of novel coronavirus, again, they don't really go into more than just those 3. Difficulty breathing, shortness of breath, persistent pain and pressure in the chest, new confusion or inability to arouse, blush lips or face. Bluish, I'm sorry. I kind of wish they had a little more because, Mari, I know you had you had some experience in seeing some papers that said that there were a lot other symptoms that started before these main 3.
If you want to read about case studies, you just do a Google search for COVID-19 case studies and read through them if you want to learn about the actual disease. 80%
of the infections are mild and can recover at home. 13.8% are severe, including pneumonia, shortness of breath. 4.7% is critical. Listen, 4.7% critical, guys. That's way higher than what people die from the flu. So, again, not trying to bring fear into this because, look, I'm part of this risk. Pre-existing illnesses that put patients at a higher risk: cardiovascular disease, diabetes, chronic respiratory disease, hypertension. Hypertension, that's the blood pressure stuff, right, Mari? Is that what hypertension is? Well, my BP was a little, my low number, my bottom number was a little high. It was at 97 both times, 131 over 97. So I'm at risk. Me being a diabetic, my diabetes is kind of out of control. I'm at risk. I'm at a higher risk. So I'm not doing this to scare anybody because, trust me, I'm in that category, guys. I'm in that category that's at a higher risk. So I felt like tonight was important just to talk to everybody because I guess it's kind of eye-opening seeing these things that, and plus my health lately here. I've been to the doctor 2 days in a row. Thankfully, so far, nothing corona-related. This is, I think, something to do with my diabetes. But nonetheless, tomorrow will be day number 3. I will be at the doctor. So we will see if these tests are coming in, if these tests are starting to come in by tomorrow, hopefully by Monday, so we can start getting people tested to find out where we need to coordinate closures of schools or cities. Another thing Mari showed me that's not good either, in my opinion, and these ads have been popping up like wildfire here on Indeed. But they're hiring, the government, the National Guard is hiring food workers, sales representatives, clerks, store clerks, everything you can think of. Let's just say this: if you work at a Walmart or a Best Buy or whatever, those kind of positions are being hired for the National Guard. And read between
that was DOD,
the Department of Defense. So read between the lines, guys. If they're hiring folks to feed our National Guardsmen, if they're hiring folks to pass out food, if they're hiring folks to operate like a regular commissary that would be on a base, that kind of tells me that the American government is preparing for possibility of martial law.
Well, I think any state that has already declared a state of emergency, you will see the job openings up for National Guard. National Guard's hiring a lot of food service and medical and x-ray technicians. The DOD in this area is hiring like shop attendants, and there was a couple other weird ones. It just made me scratch my head, and I zoomed out nationwide, and some of these other, it's just interesting to sort of dig and see what they're planning for, because obviously they're going to need more hands on deck. So, it's very clear to me they are preparing for some tough times. And especially if you live in states like California, Washington, probably Florida, in New York, you're probably going to get hit the hardest, and you'll see the bulk of the National Guard in your areas.
So, looking at this list here, they're showing people's conditions. Patient in China with history of type 2 diabetes and hypertension.
I'm going to...
Caught a fever and cough on the 22nd and then died on February 5th. Some people are not lasting that long with this, guys. 44-year-old Chinese thought to have had other pre-existing health conditions, but still developed severe pneumonia. He died 8 days after he contracted the disease. So, again, this website is full of information. Don't get caught up, though. Don't get stuck in a rabbit hole here and check it every 5 seconds. But I think Mari and I have used websites like this to help make decisions about what we're doing about our kids. Are we taking them out of schools? Are we keeping them in schools? We're trying to make the best decision. And I do appreciate our school system keeping it professional and respecting our privacy and our decision to protect our children, because that is that's our choice. That's the thing. It's as a parent, you want to make sure that you're doing the right thing to protect your immediate family. And something I saw on Tucker Carlson on Fox News this night, and he even said that nobody out there has the right to tell you what's best for your intermediate family. So protect them like you're supposed to, and take care of your family. Look, I think some people out there are keeping their kids home from school, and they've made that decision before their states have made the decision for you. I don't think parents like that should be looked at and with a strange eye. Wow, you're jumping the gun. Look, 3 cases in Ohio. Okay, that's all I got to say. And they've closed the entire state. I am from that area. So, again, I'm not concerned about keeping my kid out of school in an area that has the second most cases in the United States, where they probably will and should close schools here in the state of New York. So, all right, that's pretty much all I wanted to go into tonight. I didn't want to be up here all night, but I wanted to give out this information. I wanted to show you guys this website, since the Johns Hopkins website is down. And, guys use this to kind of track things on your own. These are the accurate numbers right now that I can tell you, based on what the numbers are on a couple different sites that were mocking Johns Hopkins' idea. These numbers right here are consistent from what we saw before the other website went down. So again, United States sits at 1,727 cases today. That's over 426 for the day. So with that being said, guys, thank you for tuning in once again to the Grand Solar Minimum channel. We will definitely have a show tomorrow night at 9 p.m. If I feel better tomorrow morning, I will definitely do my best to do something to do an update in the morning. It's been kind of difficult the last couple of days. It's been slow going for me. So I will do my best to continue to bring you guys content on this channel. Hopefully I get some good news tomorrow after some of the tests that I have coming back tomorrow afternoon. So send some positive vibes my way, folks. All right, guys, I'm going to sign out for the night. Thanks again for tuning in, and we will talk soon, guys. Take care.